market, which is a practice-facing prescription management platform and a lab management software. So I've got a couple of slides just to kind of introduce myself, doing that to kind of so you understand where I'm coming from. I have 2 kids. The one on the left is older than the one on the right. The one on the left is serving in the U.S. Coast Guard now down in Hawaii. He has a tough life. The one on the right is just laying around the house all day, and I feed him, take care of him. But trying to get him to launch is kind of a difficult thing. I'm a musician. I moved to Austin about 4 years ago to pursue some music, and no matter how cool you try to look holding the banjo, you're not going to be cool. You're just going to be that guy holding the banjo. So, also, I sail. Recently, I sailed out to the Bahamas, and I caught a world record mahi. Unfortunately, we didn't take it in and weigh it, so we just filleted it and we ate on it for about 2 weeks. But it was a lot of fun catching that. I was in the Navy for 4 years. Got out. Again, you can see my son. They say there's resemblance. I don't see it, but
he's good looking.
He's a good-looking kid, right? He gets it from his mother. But more appropriate to this group, I've got 26 years in lab management software. When I got out of the Navy, I went and interviewed for a tech support position at a lab management software company. And I showed up, business suit. I walk in this guy's office. He's wearing shorts and flip-flops. Of course, it's in Florida. So, when I got out, they said, you go to a job interview in a suit. And, well, needless to say, he hired me. Worked my way through the lab management business, doing support, report development, going into labs, helping them set up software. So I've been doing this a while, and I kept joking I was going to just stop counting after 20 years, but I guess they want to know how long you've been doing it. So a little bit about me, but what really I'm here to talk about is our practice management, our prescription management software and its connection to our lab management system. So what this creates is an end-to-end digital solution for practices to submit work to the labs and have visibility into where and when that work is coming back to them so they can make sure it's in the office when the patient shows up. And then we have our lab management solution, which manages all the production inside your lab, invoicing, billing, case tracking, reporting. So I'm going to start with the practice-facing side. So what we're looking at here is a dashboard that I can see all the cases. Can everyone see the writing or the screen? Is it too small in the back? You okay? All right. I can zoom in a little bit here and maybe bump that up some. So you can see the cases that are out right now. So all these are prescriptions, and you have the patient's name, the doctor name, who submitted it, the lab that it went to. So, the practice may work with 3 or 4 different labs. But they can see in one dashboard where the cases are, when they're going to be back. The date needed here is really the important date. It's like, well, we're going to have this back before the patient comes. So if I open one of these prescriptions after I log back in, join us.
Not this one.
Okay, sorry. All right, so I'm going to open this prescription. You can see this is a Essex retainer, and the status here at the top shows it's been checked in at the lab. So we don't drill in any deeper than that for the practices to see. We're not going to show where in the lab it is. That question pops up a lot. It says, can they see it's not even out of the model room yet, or it's due tomorrow? No. They see it's checked in, and they see it's complete, and they see it's shipped. And so again, this is the practice view of the prescription. And we've got several integrations in EasyRx with practice management software. So just a quick show of hands. How many people are commercial labs versus in-house lab? So commercial lab? Okay. In-house? Okay. So you said you use EasyRx and you love it, you said. All right.
I only have one lab that I send it to.
Okay.
Oh.
Okay. So really the key thing here is that the practice can see the status of the case when they need it back. So there's a lot of value here for the office. Rather than making those phone calls, where's the case, when's it coming, they can see it on their dashboard here. And they can filter. They can see those that were submitted with a physical impression versus those that were digitally submitted. And we do have several integrations with iOS scanners, iTero, Medit. When you are creating an RX, which I'm going to go through here, what it's asking me here is which patient. So there's a Cloud9 integration enabled here. So Cloud9 being a practice management solution, it'll reach in there and get the patient list and say, all right, who are we creating this RX for? Now, if they're not using Cloud9, there are several other solutions that we integrate with, but I'll use Ryan Adkins here. So I'm just going to connect the patient record. I don't see him readily, so I'll just connect another patient. So Addison Banks. When do they want the case back? Oops, I don't know why that's
You want questions now or later?
now. Yeah, absolutely.
So we don't let our doctors dictate to us when we're going to have cases back. We
Okay.
schedule it. We tell them when we're going to have them back.
Yeah.
Is that possible?
Yeah, you can have a standard turnaround. Yeah.
I don't mean that. We schedule our work. So if it's a week or it's 3 weeks, it just depends on our workload.
Okay.
I mean, my attitude is they don't take unlimited patients every day. Why should we take unlimited cases?
Yeah. Thomas, you want to answer that one?
Well, I think on some with EasyRx too, I think on the practice side, usually they're trying to schedule their patients for the next appointment. So that's really what we're saying here is like, give the lab a time frame, because they want to schedule that next appointment, right?
Right.
In practice. So it's not really to restrict you, it's really to give them, or to give you a time frame when they need it back. So it might be a month, it might be 3 weeks, but that's just, something you kind of negotiate with them so they know they need to schedule a patient.
Okay.
So.
Yep. Yep. Welcome. Hi. So I've set this prescription up. I don't have a date needed in there. It's going to the Williams lab. Dr. David Hornsby is submitting it, and it's going to go back to the Atlanta office and it's from the Atlanta office, shipping to the Atlanta office. So if there are multiple doctors in the practice, they can be set up here as well. And then we have an extensive library of ortho parts, appliances, dental restoration. So I'm just going to choose a full contour zirconia crown. Move that around. I got a full contour and a porcelain fused to metal, or porcelain fused to zirconia. Some of these may not make sense, but there can be easy comments that they want to add in. These can be just predefined comments that they want to use over and over, like a patient has a gag reflex, or please confirm you can meet the delivery date. And these are comments that will be submitted with the prescription for the lab. And then, as I was mentioning earlier, we have several integrations with iOS scanners. And so iTero being one, you can search for the iTero case number, and it will reach out into the iTero system, pull those files out, attach them to this prescription on its way to the lab.
Is that where they would put photos as well?
Oh yeah, and so here you can drag and drop files in this section as well. Dexis, Medit, several integrations here. We even have one, EasyRx Digitize, where they can take a physical impression, mail it to a delivery or an address, and it'll be digitized and then sent on to the lab. So I could also just say use the digital model attached to this script, or use the digital model that's in the patient file. So I'll just do that. And then sign and submit. All right, so it's telling me I need the date needed. I'm not sure why it's not letting me. Oh, there we go. So need it back by the 25th. So it does validate that you didn't put all the data you need to submit the prescription in. And I'm using my hotspot on my phone, so we may have to wait for it to. Yeah, it was submitted. So here we have a prescription 189498 submitted to the Williams lab. So that's how a prescription gets into the system. Okay. Any questions on that? All right. So I'm going to come. Yeah.
Got one. Does the lab buy this and supply it to the dentist, or does the dentist buy it?
Yeah, great question. We have two models, really. When you subscribe to Visual DLP, the lab management software, you get access to this at no charge. So you can invite your doctors to start using EasyRx for what we just did there. And it just goes against, we'll get into pricing, but each case that's submitted, we have basically tiers that you can subscribe to. And it just goes against that count.
You're going to get into all the costs. at
Yeah.
some point here.
Yeah.
Okay.
Yeah, absolutely. But yeah, and the other model is that there are features that some practices will subscribe to because they see the value in them, like some of our EasyRx 3D printing and basing and design, not design, but some other AI generated type products that they can subscribe to. And that would be a fee that they incur, not you. So. All right, any other questions? Okay, so that case was submitted. Now we're going to flip over to Visual DLP. So this is our lab management. This is what they use in the lab. The dashboard tells us how many units have come in today, invoices today. I can switch that between today, this week, the month, the year. I can see notes that have been added recently by the staff. I can see sales by department, orders that are shipping today. So it's just a really nice place to come in and look at what's going on. It's just a snapshot in the lab. What I want to do is I'm going to go to orders in my order list. So these are the cases that have come in. So here's one that we can see the case originated in EasyRx for Addison Banks. That's the patient that we're just looking at on this prescription here. So I'll open that up. It's case number 2475. All right, and I didn't map any of the products ahead of time, so those didn't come over. But the notes that we added, please confirm you can meet the delivery date. If I'd attached files, they would be on here as well. So the STL files, I didn't attach it. I just said use the one in the prescription. They would show up here as well. Due date's the 25th. Now what I'm going to do is I'm going to go ahead and add that zirconia crown because I didn't map that before I started here. All right. So now what we have are workflows. And these workflows are designed by the labs to tell us how is this case going to move through the lab, through production. We're going to check it in. We're going to design it. We're going to mill it or scan it, mill it. And these are all designed by the labs. So I'm going to go ahead and schedule this order into the lab. And so my simple workflow here is scan, design, mill, QC, and ship. And so those are the stages of production that we're going to track for this case. And workflows really can be anything you want them to be. So I'm going to go over here and look at that full contour zirconia workflow. These are my available activities. These are the things that technicians do in the lab that we care about tracking. They can be outsourced steps. If you're working with a partner, you can outsource it, just to kind of turn it into a black box. It's going out there for 5 days and coming back, and then you're going to finish it. Or they can be completely in-house steps. So. Is anybody scheduling today? I mean, yeah. Okay, so you're familiar with this?
No, I'm not using this.
You're not using, okay. All right, so back to that case. Let's look at a few things on it. You see David Hornsby is the doctor who submitted this case. Can everybody see all that? I'm going to zoom in a little more here.
It's kind of blurry.
Yeah, and it's that way for me too. Let's see if we can get that a little sharper.
Maybe I'm just bold.
How's that?
That's
Better?
terrible, man.
All right, I think
There
that's,
you go,
that's
better.
going to be it right there. Yeah. So David Hornsby is our doctor, and Gainesville Dental is the practice. And we sort of intentionally did this because we know that doctors could work at multiple practices. There could be multiple doctors in Gainesville Dental, but they want one statement. Or this doctor wants a statement for every account or every practice that he works at. So you're nodding your head, you must deal with this. Yeah, some complicated billing arrangements get proposed by these offices sometimes. So we separated the two. We have the individual, and then we have the account. Gainesville Dental is the account. David Hornsby is the individual. So the way I like to describe it, it's like your credit card, right? You've got a credit card account. I can have multiple card holders on that account. That would be the individual. They bill into one card. So at the end of the month, when we run statements, it's one billing statement per account. We've got the patient information, reference number, the prescription number. So this is the prescription in EasyRx that they can reference if they call and say, hey, is this prescription ready? Or is this case ready? And you can search here at the top of this search bar by patient, by prescription number, by product, by date. You'll notice that you've got the current activity listed here, so it's in a case prep step. So just in one glance, I can answer the question, where's my case? When's it going to be back to me when I do my search here? Okay. Any questions on that? Everybody moved to the back of the room. All these seats up here, and I have to pick on the back here. So a couple building blocks. You know, people ask us, how do I get started with EasyRx Visual DLP? When we do onboarding for a lab, we ask for certain data. We ask for your accounts, we ask for your products, and your prices, and we can import all that. So we have predefined templates. So we'll start with some of these building blocks. So doctors really are, like I said, the individuals. So let's go to David Hornsby. Some demographic information, data first order. When did they first send a case into us? Data last order, total case count. Some retention type information here. And we do have retention reporting, so you can see trends, like any accounts not sending work as frequently as they used to. And all that's based around data first order, data last order. A couple other flags. Are they a prospect? Do we consider them at risk? Are they a VIP? And all that can print right on your work tickets that you're handing to the technician. So when they see that, they can have a watermark on the work ticket. So as they're working with this case, they know, yeah, this is a new account. Let's treat them a little extra special. They're a VIP. We're always going to treat them special. So, but I know you treat all your doctors the same. So. Billing accounts, this is what I was saying earlier about the separation between the individual and the account. So Gainesville Dental is the billing account that holds all the accounts receivable data, like all the balance that they owe the lab. I can have multiple accounts, as I mentioned, so if they were, we can search for so Desert Dental may be a secondary account that they could bill into, but Gainesville Dental is the default. Now, what's nice about this is you can set up doctor preferences for the doctor that will follow them around regardless of the account that they're using. So a lot of lab management systems I've seen, and even our previous versions, if you had to set up multiple doctor records if they wanted multiple statements, which means you have to maintain doctor preferences for that same doctor across 2 different records. So. Work instructions, this is, again, at the doctor level. Anytime they send a full contour, anytime they send a Holly, anytime they send this in, this is the instruction that's going to print on the work ticket for the technician to read. The difference here is between work instructions and preferences are work instructions are free form. I can come in here and edit this and you really type whatever I want. Always do this for a full contour zirconia crown for this doctor. That's free-form text. These preferences are predefined, like selections. So if I say the preference type is occlusal preference, I'll have a drop-down preference number 1. All right, that's his preference for occlusion. And that will always print the same way regardless of the doctor. Okay. Special pricing, you may choose to give a deal for a doctor, individual doctor in an account. You can also do special pricing. So let me back up a step. We have standard price lists, and when we import your data, we'll get that pricing information from you. So you can have as many price lists as you'd like, but there may be a situation where you want to create a special price for this account or this doctor, so you can do it either way. You could say this doctor is always going to get this price, or everybody in this account is going to get this price, so you can manage the pricing that way. And then order tags are interesting. They're tags that pop up on the case as well as the work ticket. So here's a tag that says always give to Rick. So Rick needs to see this case before it goes into production. That would pop up right in front of the data entry user's face. Also, when they print the work ticket out, that could be printed at the top. So they know whatever these tags mean to the lab will be communicated to the technicians and the staff. So let's go look at the account now. So here's the account, and this is where the account balance is. And so this account owes the lab $32,000. Nice account. Now, if I go in here and look at the aging, I can see it's mostly all current. So this is where we age the balance that's owed to the lab. And you can see all the transactions. So I'm looking at everything from March 31st on. So we're looking at the current month. So they had an open balance, and then they had invoices, and then an ending balance. So it's really easy to see what the doctors owe the labs, and you can actually print this out. There's a printable view of this. This isn't a statement that you would generate at the end of the month, but if the office calls and say, hey, can you explain this balance to us? We'd like to see what we owe and break it down for us. This printable view would show this information to something you could print out or email to them. So basic account information, account name, account description. And then here, we've got 3 levels above the account name that help organize your accounts. And we did this primarily because we started seeing DSOs come up with these interesting relationships between corporate and then the group and then the individual practices in the group. So we give you a way to organize the corporate, the top level, and then the practice group, and then the individual account. And you can report across that. So if the DSO or the group says, hey, we'd like to see reporting, we'd like to know how all the doctors in this practice group that make up 5 different offices are doing in a remake, from a remake perspective, you can generate reports to share that with them. So. And then you have contact information. You can have as many email addresses, phone numbers, shipping addresses as you'd like. And the email addresses, you'll notice, have different tags on them. Case alerts, invoices, statements. So we can email invoices. When you invoice a case to send it back to the office, it can automatically generate an email with that PDF attached. At the end of the month, when you run your account statements, you can do the same. You can send an email with the account statement. And something we added recently is the practices can pay their bill now through EasyRx. So if I go to my Visual DLP labs, I can pay the Williams lab with a card that I have on file. I can see my balance is $11,000. I can either select the current balance, the past due balance, or enter another amount. So email the invoice, email the statement. The offices can pay their bill from here. They can also access their statements directly from EasyRx. So if they want to see the statements they have on even past statements. So this is a feature that was really anticipated because prior to this, labs were keeping the card on file and then running the card on a periodic basis, like every 15th of the month at the end of the billing cycle.
So do you avoid the 2%?
No.
You have
Two.
to use another party for the credit card transactions?
We have two that we are integrated with.
So it goes through you facilitate it?
We facilitate it.
So there's a
Yeah.
charge.
There is a charge. It's 2.92 right now, and it's been that for a while, I think. And it's crazy some of the fees that I see labs paying when we do analysis. I mean, I've seen like 3.5%, 4%, and so we can usually save you a lot of money on that.
Even
Amex
Amex?
is, well, everyone knows Amex is going to be higher, but I think at about 3 point, don't quote me, but it's above 3, I know. Oh yeah, everyone does. Yeah.
Is the digital DLP, is that like a new, like I've been using EasyRx for years and I've never.
Yeah, I guess I should have talked about the 26 years in lab management software. In 2019, EasyRx and Genmar was my company. We merged the two businesses together, and then because we have this cloud-based solution, it made sense for EasyRx and Genmar to start working together, and that's where it came from.
Because right now I export everything to Xero,
Mm-hmm.
and then Xero kind of does my accounting software. But I mean, if it was all in one place, it'd be a lot easier.
It is. That's exactly what.
Is there a different charge from regular EasyRx clients?
Yes, it's a different pricing structure because it's based on how many cases are invoiced through the system. And one of our sales rep is here, so I'll let him address pricing at the end of the. Yeah. So a couple other things in accounts, account settings. Really, this is where you set up your terms of trade with your accounts. Are they taxable? Are they COD? What price list are they on? Do they get a default discount on every case? Do you apply a finance charge if they have a past due balance? And what is that finance charge? What route are they on? Who's the salesperson? So I could read all these, but this is where you really set up the terms that you work with this account with. And then here are all the doctors that are in the account that can send work in and bill into this account. So here we've got 8 or 9 doctors that are authorized. Linking the EasyRx account is done here. So you can log into your EasyRx connected lab account, which I believe is what you're on. And then your practices would be linked to the account here. And again, special pricing. So if you want to set up account-wide special pricing, this is where you do that. Something really cool we do is we track every change. If you go in and someone moves the price list to another price list, you can see exactly when that was done and who did it. Just an audit log. It's really good for compliance purposes. So yeah, this is the account. Any questions on that? Or all right. Tiffany, any questions? Okay. So let's talk about products now. Products are the other really foundational building block of the system. And when we do an onboarding, if you say we're going to move to Visual DLP, this is something we would import for you. So products have names, they have an alpha code. So when you're entering, a lot of people like to keep their hands on the keyboard when they're doing case entry. Early on in my career, I started going into labs and they were using DOS-based systems, and I was astonished how fast you can be with a DOS-based keyboard and green screen, really. So some of those habits are hard to break. People want to do data entry with their hands, not the mouse. So we have alpha codes, we have little shortcuts on the keyboard that make it, or on the case entry screen to make it easy to do. The product can be broken down by department, by product type, and then something we call the major and the minor group. And all this works together to give you really detailed reporting. Like how many full contours are coming, how many Hollies did we do, or how many ortho products did we do? And that could be a minor group or a major group. And then you could break down the major group into more detail. So if you have owners or managers who really like to nerd out on data, this would give them a way to do that. You could really set up some good reporting structures. A couple other flags on it. It's an alloy product, discountable. pricing. And I mentioned earlier, you can have as many price lists as you want in the system. And price list management is simple. Here's all of our prices. You know, I've got main list 1, main 2023, 24. I can clone a price list, and I can say, here's the new name, and we're going to do a price list increase or decrease automatically when we clone this. And then I can move all the doctors from one price list onto this one in a couple of clicks. So it's really easy to set up your new price list when you do a price list increase. In the past, we'd had to help labs with data imports and spreadsheets, and it was just a lot of support time. So we built this feature into it. But yeah, back to products. Let's go look at so we'll take an Essex retainer. Workflows. What workflow do we use? And we talked about workflows earlier to build an Essex retainer. And in this case, there's a default workflow in Boston. Now, the reason it has a location here is we can actually, for labs that have multiple offices or multiple facilities, you can discriminate the workflow based on where the case is being entered. So if you had an office in Boston and one in Philadelphia, they may have a different workflow in Philadelphia if the user who entered this case was there. So just a little nuance there for anyone that has multiple facilities in their organization. You can create different workflows based on where the case is being entered from. All right. Talked about products, price list. We talked a little bit earlier about workflows, and we were just talking about them now, but they are made up of activities. So these activities are what you care to track in the lab. Some people think of them as milestones, like where is the case right now? It's moving through nicely. There are reports you can run to let us know ahead of time if something is late. So if it's not where it's supposed to be today, or if it's not been scanned. So we use barcoding to allow your technicians to scan the steps, these activities. And from that, you can determine if a case is behind schedule or not. If it wasn't scanned on the day it was supposed to be done, then you presume it wasn't done until you know otherwise. So.
How is that production delegated out to the various staff each day?
So there's two ways we can do that. It's a great question. So these are the modules that we have in EasyRx Visual DLP. We have the order management, and I've spent the entire last 30 minutes in order management. But there are other modules, the employee interface, lab dashboard. Inside the lab dashboard is a way for a manager to look at what's due today and allocate it to technicians based on skill level, based on how many units or minutes. We actually track it in minutes, equivalent to units. So let me show you that. It may not have anything due today, but we will see. Nope. So we'll go to late activities. So these are things that were due before today that aren't done. It looks like there might be a few of them. You'll notice that right here, it has a book to name. That means someone has come in previously and said, these cases right here, and as I select them, you see the activities and the minutes being incremented up. I can assign them to Timmy the technician, and I see that Timmy has 50 minutes of work already assigned out of the 480, and that's 8 hours time. Yeah, so he's there for 480 minutes a day. So we use minutes instead of units because it gives you a way to adjust the scale.
How many minutes for a bathroom break?
It's up to you. So the question is, how do you assign it? You just select the technician there, and it books those orders to him. So someone's going through and saying, all right, this is what's due today or what was left over from yesterday. And you'll see that I have over 1,200 units that are late. So we're kind of behind right now because this is a demo database and hasn't been updated. But in a production environment, that would go down to 0 at the end of each day, ideally. Yeah.
We don't assign the work before we get the employees, so they typically just take it from the shelves. How do
Yeah, so let's go back to the employee interface. So this is how your technicians and your employees interface with the software.
So they just go back to the computer and look it up?
They can barcode, they can batch scan. So on every work ticket, it's going to be a barcode, and then there'll be another report next to that scanner of the things they can do. So they would just scan their ID, scan the case numbers that they did, and then scan the activity that they completed. So it's real quick. I mean, it's under this interface here, batch scanning. So I would just scan my employee ID, what did I do, and then I would just fill in the order numbers. So it's really simple.
So how do they know what they have to do that day? How do they access, you know, if I go, okay, John, I'm gonna give him these cases.
Yep.
Is there a way he can go to it where I don't have to mess with him?
Yeah.
Just go, okay.
Yeah.
For today?
Yeah, when they choose who they are, when they come up to this interface and say, all right, I'm Timmy the technician, show me what have been assigned to do today. Yeah, it'll show them. Yeah. But yeah, we have 3 modules that are used full-time. The order entry or order management, the employee interface. And there's actually a time clock built into it as well. So let me get logged in here. Wrong PIN number. Let's do that again. There we go. So here they can look up an order that they're going to work on. It's going to give them all the information about it, materials, notes, design, schedule. They can clock in and out. They can enter materials, or they can book orders to me. They can see what's already been assigned to them. Materials would be, you know, I used this acrylic, or I used this part, or I used this on this case, and we care about lot numbers at our lab. We want to be able to track that. So that's how the interface, or how the employees can add that information to each case. So. Yeah, there's a time clock. We can run reporting for overtime. It's interesting when you start getting units that they've completed and the time that they did it in, you can start looking at performance across technicians. And what this is telling me here is I can't leave this interface if I don't know the password, so that way you don't have to constantly go back there and log them back in. So it stays on this site until someone with the password logs out and goes back.
You are able to compartmentalize this where I only can see certain things.
Yeah.
Kind of on a need-to-know basis.
Absolutely, yeah. And I should have mentioned that when we looked at that dashboard earlier, all the financials that popped up, those can be hidden based on your user group. So if you have someone doing data entry, like the employee interface, think of this as okay, I've got a login here. I've logged in. So you may have 4 logins for just the employee interface sprinkled throughout the lab. They would never have access to order management, to run reports, or see financials. But they can access the order interface or the employee interface in the lab dashboard. Yeah. And one thing I'm going to point out is we don't charge by users or modules. So when you subscribe to EasyRx, you get the whole ball of wax. I mean, we don't.
So there's just one system.
There's one system, and you get everything. Yep. So let's go back to order management. While we're talking about employees, I'll go under people, employees. And let's take our employee, Timmy the technician. He's right here. So here is the PIN number that I use to get in on the employee side. How many daily, what's their daily minute capacity? What's their capacity for the day? How many minutes do they work? What department are they in? What location are they at? And then here's the activity list that they can actually get credit for scanning. They only do these 4 things. So that's how you determine who's doing what. So that you can't get someone scanning other people's work that they don't actually do. And then the time clock records are here. So you can run reports and see when they've been logged in and out, or clocked in and out. All right. I'm going to leave that. Reporting. One of the things we do a lot of is write reports in the system. Every lab seems to have their own flavor of reports. There is a report designer built in you have access to as a user, so you can go in and tweak your own reports. It's really helpful for statements. Like if you have a message at the bottom of the statement that you want to send out every month, you can go in and update that without calling support. But you can see some of the reports here. Account sales in month by salesperson, daily report, which is really a snapshot of how many invoices did we do today, how are we trending versus a year ago, payment registers, just a tremendous amount of account and order reports available in the system. And a nice thing is you can come in and favorite your reports, and then I can come in here under favorites and they'll be in the same spot every month, so I don't have to go hunting through that list and find what I'm looking for. All right. Another thing that we offer is EasyRx Forms. And EasyRx Forms is a way for you to solicit feedback from the offices. With each invoice, you can automatically email a link that would allow them to give you, in this case, order feedback. So if I wanted to come in and, let's do this, manage a template here. So here's my order feedback form. Tell us how we did, right? And this is all defined by you. You can design this interface for your needs. How would you rate our service? What's the best part of our lab? So with each invoice, you can email this out. They'll get a link. They can fill it out, and then you'll get the responses right here in the software. So I can come in here and see what they submitted. And oh, this is an onboarding form. This is not a feedback form, but you can use it for new customer onboarding as well. So if you have a way to, this will give you a way to collect all the demographic information you need to open that account. Here's the order feedback. Yeah, so rate us on how we did. How was your removable prosthetic? So, is anybody doing anything similar to that with like your invoices having at the bottom of the, I've seen a lot of labs do that. They design a feedback form on it. Do you get a lot of responses?
Yeah, with the lab management software we have, it's just auto included, we can't turn it off.
Okay.
So pretty much just a few accounts and they nitpick. They usually.
You never hear good stuff, right?
Yeah, no,
Yeah.
exactly.
Yeah. That brings up a good question, or a good point. All of our forms, invoices, work tickets, statements are designed for you. So it's part of the onboarding process. When we set you up, we look at what you have, or we give you a library of what we've done in the past, and you can just kind of pick what you like. And then, so we don't have one standard invoice or one standard statement. It's all designed for you. All right, well, I am slowly approaching what I was going to hold off as Q&A, but I know we've been asking questions, but are there any questions that haven't been addressed yet or asked? Yes?
So we have a few accounts that like to use EasyRx, but we have our own lab management software currently. So we have to double enter when a case is actually shipped out.
Yeah.
Is there a way to integrate it where if we mark it shipped with tracking numbers in our own lab management software that will also apply?
With your current lab management software?
Yeah.
What do you use?
Lab Next.
I don't think so. Yeah. Yeah. No.
When are you gonna get it working on an iPad?
What? What? I actually have my iPad with me, so we'll see what's wrong with it. I know what's wrong with it.
Is it easy to migrate like the old EasyRx into the new, into the digital?
I think so, yeah. We can export your customer data. Yeah.
Just should be seamless.
Seamless is a loaded word, but yeah. It should be painless. How's that?
Painless is good.
Yeah. There was a question.
Yeah, so you were saying that the employee, when they scan the barcode to keep track on the workflow, they're not able to see the invoices and everything like that.
No.
Is it possible that we can give them a right to check?
Sure, they can if you want to give them access to it. they can have an account that gives them that permission to log in and see. It's
So
just,
that would be like a different account for them? to log in?
yeah, they would have a login versus the PIN number that you use just to identify who you are. So there's two types of records. There's a login that, when I log into the software, I get certain permissions to access parts of it. But technicians and employees, through the employee interface, just put a PIN number in, like a secret code, and it just gives them access to scan. But if you wanted that person to also have a login, that's okay. So, yeah.
Somebody gonna talk about pricing?
Thomas. He's got it
Yeah, so
dialed in better than me.
if you got, and kind of, it really depends on your lab and what you're doing, and we have a booth here, so if you want to come by and kind of talk about your particular situation. But it starts at $195 a month, and that includes 250 cases, invoice cases, and you can manually enter them, or they can come through EasyRx, and we tier up from that based on your volume. So the more you do, essentially the less you pay in a way. So like the $395, you get 1,000 cases, but your overage is only 10 cents a case. So it's graduated.
Yep. Come on, I saved all this time for questions. Yes.
A lot of times we have to adjust the invoice or the design when
Mhm.
we're shipping out the case
Mm-hmm.
for one reason or another.
Mhm.
What would that look like? Because typically the people that handle the shipping or the invoicing aren't technicians.
Yeah.
So we have to like write stuff down for them. How would they?
Yeah, great question. So let's take this case, 2475. It's come up for invoicing. It's coming out of production. There are notes on it on the work ticket. We've made some changes. All they'd have to do is come in and either add a product or delete the product, so they can just make the modification before they invoice it. If you invoice a case and then you realize you made a mistake, which I know never happens, but this green case indicates that it's invoiced, or this green text here, I can actually come in and uninvoice this case, make a change to it, then re-invoice it, which that kind of horrifies controllers and accountants, that you have an invoice that went out that you can now change, because now there's a piece of paper out there that says one number, same invoice number. But it's, realistically, mistakes happen, and there is an audit log, so we can show that it was invoiced, uninvoiced, changed. So it would be difficult to really abuse that. From a financial side, I mentioned I didn't really go much into that, but we talked about credit card processing. We do that through EasyRx, but we also have a way to run multiple cards at one time. You can come in and say, I want to do my end-of-month credit card billing. And so here are 5 accounts that have that set up for end of month. I can see what they owe, and I would just select those that have a balance and a payment type. Some of these don't have payment types in. I'd select that and then process these cards. It would hit their card, enter a payment all at one time. So it really saves a lot of time. And then we do a couple other little neat features like volume discounts. So at the end of the month, you could say, anybody on this price list, I'm going to calculate a volume discount based on what they've done with this. And so that would just create a credit on their account. You could set up the tiers. So if I select main, so anybody on the main price list, I don't have any accounts I don't think I set the tiers, so that's what it is. So you could say anybody that did like $0 to $5,000, we're going to give them 1% rebate. 5,000 to 10,000, 2%. And of course, we enter payments. Just enter a payment like a check that you receive. You just create a payment, goes against their balance, same as a credit card. So if you have to do a reversal of a finance charge at the end of the month, you could come in and adjust that from an AR perspective. So yeah, it is a full-featured accounts receivable system. We don't do payables or general ledger, but that would be more of a QuickBooks or you maybe use that for 0 for that. Any more questions? Okay, yeah, it's my go-to. Yeah.
We have a bunch of, not a bunch, we have a few accounts that have to pay before we do anything for them for obvious reasons. Is there a way to send them like a link to pay instead of calling them and writing out a credit card and then re-entering it where it's like
So you,
your invoice statement?
yeah, you can actually get that card once and store it with the account, and so you could use that each time you have to charge them. And it is stored securely. We don't store credit card numbers in our system. We tokenize it with our payment processor, and so all we get is, so it's PCI compliant is what I'm trying to say there is. So yeah, you could use that card and run a payment, and then you'll have what's called an unapplied balance sitting there waiting for you to invoice that case and then apply that balance to it. Yeah, so there's a pretty easy way to do that. You got more, I know. Thomas,
You want to show the AI real quick?
do you want to show the AI?
I don't know how many of y'all are doing bracket removal and basing for customers, but we have a really great solution for that too.
Yeah, I'd like you to do that if you want.
You know what I'm saying?
Yeah, I'll let you take that one.
Are a lot of y'all doing bracket removal and basing? Yeah, thank you.
You got it.
Hey, I'm Thomas. Nice to meet everybody. So, a couple years ago, we were getting the requests from a lot of labs and a lot of practices that have in-house labs to develop software that would make it really easy to remove brackets, base models, do digital blockout. And now we have the whole kind of migration to the PTS trimming machines. And so built into the interface in EasyRx, we actually have a command center when scans come through. This is actually on the practice side, but if this was a lab account, you would see all new scans that come through, the original files. And then you can optionally request batches over here on the left-hand side. Let's say you knew I had 20 files I needed to do bracket removal on. You could select all those files and then click request. And then you would be able to request your bracket removal, auto basing, and you can kind of see all your default settings. So if you like to do horseshoes, or if you need to change to a full pallet. And something, I don't know, there was somebody that was going to present here, the shell molds, where you can actually pour into kind of the inverted shell. So that's something that we've added, and we've actually added an option where you can do, I think it's a 0.2 millimeters, so you can cut it away. And so that way you don't even have to print the model, you can just do it directly through the AI. It's pretty cool. And then if you're doing blockout, or if you had a PTS trimming machine, you could request those services. And ultimately all those run in about 5 minutes flat. So you're gonna have file output in 5 minutes for all those files. So instead of taking 5, 10, 20 minutes per file, you can do 20, 30, 40, 50 files in about 5 minutes. So it's super quick. And then you just log in here and you see your files that are completed. And if you ultimately want to do any, you want to check them out to make sure they're up to your liking. You can open the original. In this case, I'm going to open, kind of show you a file that had wires. And this is file output without any cleanup. Sorry, we're going off Andy's pocket over there, I think. So this is our original file. Let's zoom in a little bit. So you can see the wires are in on this file, and then with any luck, we're gonna see the other one. So this is without me doing anything to the model. So the AI removes the brackets, removes the wires, leaves a little bit here that we can clean up with our tools we have built in over on this side. But if we need to do any carving away, smoothing out, you have all the tools built in. So it's pretty incredible if y'all are doing that. If it's something you're considering doing for practices, it's really, you know, I feel like cost effective depending on the volume you're doing. We kind of start out at 106 a month, and it gives you 50 arches for 2 of the services. So if you do bracket removal and basing, ends up being about $2 an arch. And then depending on your volume, we can kind of go from there. So anyway, questions about the AI or?
Are you able to do that with cases you don't receive through EasyRx? Like if you receive them from a different scanner, if they're emailed to you, can you just import them to EasyRx and then apply these same features?
For sure, yep. So you can either create a patient record on your dashboard and upload them, or you can create a prescription on your side. Yep, for sure. Any other questions? But if y'all want to come by and see a little more in-depth view of it at the booth, you know. How many EasyRx customers do we have in here? Awesome. Well, that's great. Well, thank y'all. Yeah, if you're not using this now, you know, come by and we can talk about it. We have,
About the AI. If we have one that either fails or it doesn't like trim the model properly, is there like a refund for that, or do we have to keep a log for that?
so if you don't, you know, it depends on what you consider fail. You know, if it actually runs on the model, you know, and the model is really poor, like you have a bunch of, I guess, artifacts and, you know, material on the model where the AI can't effectively process it, you know, that's kind of up to you before you run it. You know, it'll tell you if it can't run. Like if it doesn't process at all, it won't run. If it
Recently we've had some where like it's cutting off like the back teeth, or you know, so we have to then just edit it ourselves.
so if it's cutting off
We
the
need
back,
back teeth, you know.
yeah. So if it's doing that, we need to know about it ultimately because it shouldn't be doing that, and we can look at those files and find out why it's processing those that way. But yeah, we wouldn't. Hopefully, you're not having to keep track of that many of them, and if you are, just let us know. Yeah.
We just started doing AI like I think the end of February, and we've had like I think 5 models at least come through that it cut the 8s or the 7s off.
Okay.
That we had to re-edit the model to get it, you know, proper for the prescription.
So there is a tab. I don't know if it's live or not, where we're adding a rerun tab, and if you have to rerun it, it won't charge you again for that model. So that's going to be an option. But otherwise, we just need to look at those models. That way we can fix them. Thanks for asking, for sure. Yeah, if you're encountering problems like that, the only way we know is if you tell us. You know, we can get in there and kind of look at it. I see any other questions? Yeah, I appreciate y'all. Let me jump in. Thanks, Andy.
Absolutely, yeah. Thanks, everyone.
Thank you.
We'll be at the booth today and tomorrow. Yeah.